All right, everyone, we should be live, but we're going to double check. And we appreciate everyone that's on right now, listening to and watching and witnessing another episode of Let's Talk America with host Shana Thornton. You're watching Real Talk, and we are live. Everyone, welcome. Happy New Year. This is our second episode of 2025, and we are excited and elated with joy to be back on talking about health topics and so much more. Today, we're going to put the spotlight briefly on a very important topic. We're talking about ear, nose, and throat. We're talking about your sinus concerns along with their allergies. And that's right, it's not April or May, but many of us know that allergies can be year round. Where Shana is no expert. You're watching Let's Talk America with host Shana Thornton. But we seek the best and the brightest experts and advocates out there. And I'm super excited to have he's not a newbie anymore, a novice on the show. He's a friend of the show, we would like to call him. It's the one and only. He's a neck and head surgeon. We're talking about Dr. Fletcher. Dr. Fletcher, welcome back to the program.
Thank you. Thank you for having me, Shane. I appreciate it.
Oh, super excited to have you on, sir. We're going to talk health, all things health, dealing with the sinuses, the cavities, everything that comes with it. But one of the things you may recall that we love asking our exclusive guests, right? I've seen your resume, your CV. You're super impressive, obviously a very popular expert in your field with surgery. But what got you here, right? I mean, when you went to medical school, there were lots of different routes you could go in life. Why did you choose to focus on ear, nose, and throat? Why was that a personal and professional passion of yours, doctor?
Great question. So, I started out as an English major. I went to Morehouse College many moons ago and graduated with an English degree, but I was pre-med. I decided to go into medicine sort of toward the end of my undergrad, and I made a decision based on a spiritual experience where I felt like I was having a calling into surgery. So when I got to medical school, I knew I was going to do some type of surgery. I wanted to work with my hands, train my hands and my mind at the same time.
Nice.
So I kind of, we get to rotate through each of the different surgical specialties, and I really was drawn to a few different ones, but ear, nose, and throat kind of came out because of the different variety of surgeries that we get to do. We get to do big surgeries, small surgeries. We work with children. We work with adults. We work with cosmetic things. We work with cancer. So I like the variety. And then I found a mentor who basically took me under his wing, and he was also in ear, nose, and throat. And he gave me a lot of interest in the field, and the rest is history. I just kind of got into it, and I love it.
Yeah, you stayed with it. How long, sir, have you been working in the field now?
So I got out of training in 2013. So it's been a little over 10 years now. And it flew by, But I've been on my own now since about 2016, having my own practice. And
congratulations.
Yeah, thank you. So I took an entrepreneurial route, but I love what I do, and I feel like I got the right field, just the right field.
Yeah. Well, you come highly recommended by many people. Again, we're speaking with the one and only ear, nose, and throat specialist. He's a head and neck surgeon. We're talking about Dr. Fletcher out of Atlanta Metropolitan. You're watching Real Talk, which is an exclusive video edition of Let's Talk America with host Shana Thornton. I am Shana, of course, and I'm so excited to get it going on this important episode of your health. Now, you know the deal here. If you're a first-time watcher, viewer, or you've been on before, we want your questions. How many times have you said, if I can get a doctor in a room and ask him a question or her a question, what would it be? Well, this is your time now. We're talking about all things related to your sinuses, sinus cavity, right? What you've got, drainage, post-nasal drip. Do you suffer with it like so many people do? This is your time to ask an expert now. So get those questions in. Also want you to get your comments in. What has worked for you? Friendly reminder, FYI, this is for general educational purposes only. It's for awareness. For more specific information dealing with your own health and body, you're going to seek the expertise and those answers from your own personalized provider in your area that you're seeing, okay? But get your questions in. We want them in now. I've got to start off asking a very common question that I think relates to so many people, Dr. Fletcher. When they think of winter months, so many people will say it seems to be the constant nasal sniffing constantly, the drainage, and so much the ear stuffiness. Help us out. Does that seem to peak more in the winter months? We know that the spring has its own battle of pollen, the eyes rolling. But so many people will often say to me, like, they can't get the nose right, my ear's stuffy. Is that something that's common?
Yeah, it is actually. So the winter months bring a lot drier air, and so one of the functions of the nose is to humidify and condition the air for the lungs. So when the air is passing through your nostrils, it's basically providing warmth and moisture by congesting, which is allowing more blood flow into the membranes and the tissues of the nose. So as it passes through, it provides warmth and humidity. So when the air is very dry or when it's cold, the nose has to work overtime to provide that function. So it ends up being a little bit more congested. It ends up being more runny because it has to work to counteract the dryness and the coldness of the air in the winter months.
Wow. And so, so the dryness really produces that?
Well, the drier the air is, the more congested you need to be to humidify and warm the air. So typically in the summer it's really humid, so your nose is a lot more open. You don't have
Yeah.
to be as congested because your membranes don't have to clog up as much on purpose to provide that blood flow that changes the condition of the air. So the drier the air is, the colder the air is, the more congestion, the more runny nose you have naturally, even if it's not allergy related.
Yikes. Okay, tell me something that seems to be also common that I know pharmacists and they're like people often come in saying, I've got this drainage, this phlegm in my throat. I think the experts will call it a post-nasal drip, if you will. Help us out. Explain exactly what it is. I think some of us can piece it together, but why does it seem to be common in some people, particularly year round than others? And I've got to ask this question because I've often heard that when it comes to children and post-nasal drip, that there's a connection to ear infections, possibly. You're the expert, you would know. But children can often have a smaller ear tunnel or drum. I think that's what I was once told. But with adults, are there some people that are more genetically prone to have postnasal drip or even ear infections, if you will?
There's a connection between runny nose, ear infections, stuffiness in the ear, and allergies for sure. So the same membrane that you have inside of your nasal cavity is also inside of your middle ear, where your ear infections would originate.
Okay.
So those tissues react the same. So typically, the same people that have a stuffy nose will have stuffy ears as well. So the membranes are exactly the same. So the reaction is exactly the same. It just feels different in different parts of the body. As for postnasal drip, it's actually a partially normal phenomenon, which is your mucus cycles throughout your head and it ends up in your stomach through the process of it draining through the back of your throat.
Okay.
There's always some mucus going back there. I think the statistic is we make about a liter of mucus per day in our
Yikes.
sinuses, and that basically is a kind of like a fly paper. It catches allergens and different germs that get trapped in it, and we basically sweep it back through these little hair cells called cilia, which are also in the lungs and in the upper airway, or lower airway, I should say. And those are responsible for continually draining the mucus into your esophagus where you swallow it. And so there's always some degree of postnasal drip, but the thicker the mucus gets, the more irritating it gets. And also, as you get older, you have more postnasal drip, which is just an age-related change. And so there are some normal degrees of postnasal drip where it's entirely normal, and then there's other times where it's actually a sign of an irritation of your sinuses and your membranes.
Oh, wow. And I'm assuming this is just me guessing here. I'm no expert. You are watching Real Talk produced by Let's Talk America with host Shana Thornton. I'm Shana on with the one and only physician, very popular, well respected, acclaimed ear, nose, and throat specialist. He's a surgeon. He is a head and neck surgeon. I'm talking about Dr. Fletcher out of Atlanta Metropolitan. I've got to ask this. Can the postnasal drip could produce almost a cough? Often heard providers say all of that is connected. So you've got the stuffy ear, you've got the postnasal drip, you got the cough, the phlegm. So it's almost like an ever-ending cycle for some.
Yeah. And so, like I said, you're normally going to have, most of the time you don't notice it. So it happens, every time you swallow, there's a little bit of mucus that's going down that's being
Yeah.
produced from your sinuses. You only kind of really notice it when the mucus is either too thick or it's dry in your throat, and then it produces irritation. So the amount of mucus that you produce is, like I said, it's relatively constant unless you have some type of irritant, like something you're breathing in, whether it be something you're allergic to or something in your environment. It could be a perfume, it could be a scent. Some people have really sensitive noses where they produce more mucus in response to perfumes or dyes or things like that. And so it can cause throat irritation if the mucus is particularly thick because it has to enter your throat in order to get down into your esophagus where it's swallowed and digested. So typically, the thicker the mucus is, the more you're going to notice it,
Yeah.
and it could be more irritating. The more the thicker the mucus that you produce on a regular basis. So if it's nice and thin, you don't normally notice it, but if it's
Okay.
really thick, you feel more irritation in your throat from that.
What a great conversation. We're talking about ear, nose, and throat, your sinus concerns, your allergy concerns. I've got to ask this, doctor, when you talked about mucus and being thicker, is there a long-term negative effect of constantly having thick mucus that may perhaps does not get addressed? Right. And could it almost irritate the throat, the esophagus? I'm sort of throwing that out here, having some general knowledge of your body. Is that possible?
Yeah, it's possible. I mean, the thickness of your mucus is generally a good sign of how hydrated you are. So if you have
Oh,
really thick mucus, if it's discolored, greenish, yellow, that could be a sign of an infection. If it's really thick and tenacious where you're having to cough it up, that means that potentially either you're making your nose is irritated, or you're just not you're not drinking enough water, which would normally thin
okay.
the mucus out. So
Okay. So be mindful, obviously, to get the water, to get that hydration in. That's key
absolutely.
year round, especially I would imagine when the air is drier, right?
Yeah, for sure. For
Yeah.
sure. Yeah.
I love it. We are watching the one and only Dr. Aaron Fletcher. He's on with us, ear, nose, and throat specialist out of Atlanta Metro. Get those questions in. And speaking of questions, doctor, we're going to dive right in. We appreciate our Facebook family watching us. Rochelle out of Atlanta Metro says, good evening. I remember having these similar symptoms when I was diagnosed with celiac disease. Speak more on that, doctor. I mean, so there's actually a condition, a disease that people can have. Define that for us in layman terms, because we're all not surgeons like yourself, of course.
Yeah, so celiac disease is actually a form of allergy. It's essentially an inability to process certain byproducts of wheat or gluten, which are essentially carbohydrates. And some people have a gastrointestinal condition which produces, or where they're not able to properly digest certain carbohydrates, and so that's what the celiac disease is. It's not my specific area. It's more of a GI thing, but I do see a lot of patients with it, especially those that have certain food allergies, which we do recommend testing for. Um, but yeah, that disease, I'm not sure if there's a direct connection with the sinuses, but it is something that is related to an allergy or inability to process carbohydrate.
Wow, thank you so much. And what a great question, Rochelle. Next up, we have Shana out of Atlanta. And she says, is there a daily regimen for one can try to relieve regular morning sinus issues? Great point. I think in the morning we seem to be a little more hoarse, a little more draggish, and everything that we're doing, everything seems to be slowed down. Help us out.
Yeah, so I'm a big proponent of doing a sinus rinse or a sinus cleanse. There's various different products. I actually created one of my own, shameless plug. I've got my own little sinus rinse kit, but I think it's good to do that in the shower. When you're asleep, a lot of different things can happen. You're still making the mucus and you're still swallowing it. A lot of times it ends up in your throat in the morning, which can be a sign of reflux, actually, where the acid is coming up and irritating the throat tissue and making you produce more mucus. So anytime you have extra mucus in your throat, you feel it. It can cause sore throat. It can cause hoarseness. It can cause trouble swallowing. So I recommend people do a good sinus cleanse in the morning, preferably in the shower when the steam is able to kind of relax the membranes in the nose, and you can get a really good cleanse. That helps to do a few things. It helps to wash out any potential allergens that are building up in your nose.
Okay.
Nose is basically a filter, so they have little hairs that we all are aware of to basically filter out particles. But when they get trapped in the mucus or inside the nose, you want to rinse it out really well. So I recommend doing a good sinus cleanse in the shower. And then sometimes maybe even before bedtime, so that it just kind of helps to keep the airway clean.
I love that. And is that something you recommend, sir, for children as well?
I do, yeah, especially allergy season. It's a good thing to do because your nose is always filtering out different things. It could be pet hair that you're allergic to. It could be mold. It could be dust, which are things in the home. To your earlier point about certain allergies in the wintertime, it's usually the ones that you encounter in the home, which is dust mites, pet dander, things
Yeah.
like that, food allergies.
Yeah.
Even if
And,
you're not
and
outside.
things you can't escape.
Yes,
Yeah.
exactly.
Yeah.
And things you may not be aware of. So the first step is usually just to get tested for allergies. If I had a nickel for every time someone said, man, I didn't have any problems until I moved to Georgia, and then everything went haywire, I could probably retire tomorrow because it's so cool. And that's partially because of the combination of trees. There's a lot of trees. There's a lot of grass in Georgia. Very, sort of environmentally friendly city. And so a lot of people that move from the West Coast or move from overseas or the Caribbean or Africa, they always come in and say everything went haywire when they got here. So
I've got to tell you this. We've had other physicians of different specialties on, such as yourself, but they've often said, people will say, this never happened until I turned 49 or 50. And I'm thinking, not a medical expert like you, but a journalist and in public relations, but you've never also been 50 years old before. And is it fair to say, doctor, as we age, because gynecologists have come on and said it, cardiologists have said it, endocrinologists on the show have said it, the older you get, the body can change. And some of that is what they sort of consider standard normal. Is that the case when it comes to ear, nose, and throat as well?
Yeah, it is. I think one of the really important facts that I would like to impress upon the audience is just that, allergies are not an all or nothing thing. You can have no allergies or virtually no allergies when you're a child. And then as you get older, they can become, worse. And so a lot of people don't develop allergies until later in life. And like I said, it could be a change of location. It could be the building that you're in has a particular dust that you've never been exposed to. Your allergies can actually get better with age. You can start with an allergy in childhood, and then as you get older, it kind of fades away. So both things can happen. It's very dynamic with allergies, and it really is just environmentally related. So changes in environment can produce a brand new allergy.
Wow, we've got the questions rolling in, but I've got to ask you this. When you say it can improve, but it has to do with the environment, obviously something that's been in the news lately, of course, is global warming, sir. There's slight debate, but there are many experts that certainly agree that the Earth has been warmer in the last decade. Right. In your professional opinion, if it's true or not, but let's say it has gotten warmer, right? There's data that certainly does support that to a large degree. Would that affect also how the operation of our sinuses are working? Is that possible?
Not necessarily the way the sinuses work, but it can produce more of the pollen, because if you imagine, the warmer it is, the longer the season goes. So the spring is longer. So which means that, as we produce more carbon dioxide, the theory is that, trees convert carbon dioxide into plant life. And so that includes pollen. It includes all of the different molds that come off of trees. So the more CO2 that's being produced, the more the trees are producing more pollen, and the longer the allergy season can potentially last. So allergy season used to be a lot shorter prior to the level of CO2 being this high. But now that they're where they are, the trees are actually hyper producing this pollen. And so it's actually having a big impact on the length and the duration and just the quality of a typical allergy season.
Speaking of seasons, as you know, the Southeast got hit pretty hard with some snow, in particular, Georgia, parts of Alabama got hit. Does that affect anything when I think of allergies, or is the cold and snow actually good because it freezes things? How does that work?
I don't know if it has a direct impact. I think, certainly colds can, just the cold air can make you susceptible to respiratory infection. There is that we're indoors more, so we're in more circulated air, and so we're more exposed to potential germs. And so one of the factors in sinus health is upper respiratory infections are one of the main causes, along with allergies. So if you get a lot of colds or viruses, that can cause the membranes in the sinus cavities to shut, and that basically traps the mucus, and it makes it a good material for bacteria to grow up. And that's usually related to cold, because a lot of people are getting cold, viruses, flu, and things like that, common cold at that time.
Shana out of Atlanta says, great information you're sharing, doctor. She appreciates it. I've got to ask this before we move on to the next question. And we want your questions coming in before we jump off in a few minutes, everyone. You're watching Let's Talk America with host Shana Thornton. I'm Shana, your on-air host and executive producer. And we have the privilege of speaking with one leading medical expert, and it's Dr. Aaron Fletcher out of Atlanta Metro. He's an ear, nose, and throat specialist, and also a head and neck surgeon. So he certainly knows exactly what he's talking about. When you spoke of bacteria and respiratory illnesses, I don't need to tell you, sir, that the Southeast, in particular Georgia, happens to be unfortunately leading the nation in RSV and flu cases, along with COVID. It's cold weather. I guess it's hitting because one, some of the things you just described, but is it also because we're indoors more and we're interacting more? And if you've got the germs, you're going to share it with me if we're conversing?
Correct. Yeah, respiratory droplets, or basically spit, for lack of a better term. Those are things that are factors in transmitting not just viral illness but also bacterial illness. Specifically, strep and staph bacteria are transmitted by way of respiratory droplets. So the more indoors that we are, the more we're in each other's faces, the more we're being
Yeah.
exposed to each other's germs, and they're being recirculated through the HVAC systems in our respective.
Ah, that's a good point. So in office buildings, often when we're below, it's from office to office. If I've got a cough, it can go next door to who's ever next door to me, right?
Correct.
Yikes. And I'm sure we're going to get you to give some quick tips at the end of how to avoid that. But I can only think of, you're going to probably say, help wash those hands, right? Just a
Yeah,
hunch.
for sure. For sure.
We're going to move along with the questions. Cassandra out of Atlanta Metro says, are there any natural remedies, doctor, that effectively reduce allergy symptoms and help thin mucus? Great question, Cassandra. Thanks for joining us.
Yeah, well, I think the best thing you can do, like I mentioned before, is to get a good sinus rinse, because not only does it thin the mucus by adding additional moisture as well as hydrating yourself, but it also mechanically breaks up some of the mucus that gets stagnant in the nose when we're not washing it. So one of the theories behind chronic sinus infections is what we call biofilms, which is where you have a layer of mucus, which is essentially inundated with bacteria, and it just never goes away. You can throw all the antibiotics at it you want, but unless that biofilm is mechanically broken up by either a rinse or some other, a procedure, then it typically will just become a recurring sinus infection that never clears. So
Oh, wow.
rinsing your nose out is just a good way to keep the mucus healthy, keep the membranes healthy into a system, and basically clearing old mucus and particles that get trapped in the nose.
Great information. Something I think many of us didn't realize that we probably should be doing. And you're saying it's natural, right? It's no
Yeah,
medical pharmaceutical that you're putting in your body. It's just simply naturally rinsing and draining that nose, right?
yeah. The typical sinus rinse, if you go and go to the pharmacy, they have pre-mixed packets, which are basically salt and baking soda. So you can really make your own sinus rinse at home with just salt and baking soda, and a little
Yeah.
either distilled or bottled water. Warm it to a temperature that's comfortable. Some people like it warm, some people like it cold, and then do a good rinse maybe once or twice a day during allergy season. And that's entirely natural. It's kind of like brushing your teeth, but it's just, cleaning your nose.
I love it. Thank you for sharing that with us. Chutney out of Atlanta says, how often should you get your ears cleaned by a physician rather than always using Q-tips? Help us out, because I think
Yeah, I'm
there are
so
many
glad
people
you
in their
brought
families, they have
that.
Q-tip every other day. I've
Yeah,
heard mixed reviews. Is that healthy?
yeah.
Is that the
So
right
first
thing
of
to do?
all, you never want to use a Q-tip. Don't ever put a Q-tip in your ear. That's not always for. The blunt end of a Q-tip actually pushes the wax further in, so then it becomes harder to retrieve once that happens. So if you're the type of person that likes a doctor doing it, I mean, there's all kind of gadgets out there now for cleaning your ears. But if you're the type of person that wants a medical professional to do it, it really depends on how quickly the wax accumulates. Some people make wax a lot more easily than other people. And so I recommend 4 to 6 months as a starting point. And if the wax is building up more than that, I have some clients that come in every 3 months, but usually 4 to 6 months is a good time frame, because you do need a little bit of wax in there. The wax is what
Okay.
keeps the pH balance of your ear. It
Okay.
also provides moisture to the skin of your ear canal. So if you're cleaning it out every day, you actually are setting yourself up for a dermatitis or dry, itchy ears. So you want to leave a little bit of wax behind. But when it's starting to feel like you can't hear, or it's basically completely clogged, that's when you want to get them clean. And I would say that's like 4 to 6 months.
Okay. Thank you for sharing that. And I've got to ask this. You're saying wax is necessary to some degree to help with the pH balance. But what would be the negative effects, sir, with too much buildup of wax that's not being removed? Is that something that can have a negative impact on your health, or not really? It's more irritable than anything.
Yeah, it actually it can impair hearing in some people. I
Oh,
have people who come in and say they can't hear. I don't know if you've ever had your ear. We've probably all had an experience where we couldn't hear out of one ear, and it'll drive you absolutely crazy, even for just a couple of hours. So I have people that
yeah.
go weeks without being able to hear, and that's a big impact on their daily
Yeah.
function. And then it also can cause tinnitus. It's one of the causes of ringing in the ears, where you basically hear a ringing in your ear. That can cause
Yes.
as well. So there are some not uncommon side effects. The main one being hearing loss and pain as well.
Yeah. And I do want to point out a neurologist recently shared some information that I came across of saying that when they think of dementia and some decline as we age, that not being able to hear, hearing loss, is
Yes,
also one of those things to be very concerned with. And I'm just saying this as a journalist, I guess it would be more of a disengagement. So we certainly don't want to get used to, well, I can't hear it in my left ear. Let's move on. We want to certainly address that, right, doctor?
correct.
Yeah,
Yep, absolutely. It's
such
one of the
important
first
information.
signs of dementia. I mean,
Yeah.
one of the first products, dementia can be produced by hearing loss.
Yeah, so certainly we want to stay on top of. And if we do have permanent hearing loss, I know you certainly being an ear specialist as well, can certainly say there are remedies or things we can do or resources, right, to get us back in touch.
Yeah, so the first thing is just to get a hearing test. If you feel like you're having a decline, if you notice people saying, "Hey, you turn the TV or the radio up really loud," and or I always have to repeat myself. Those are usually the common things I hear. You
Yes.
might get a good hearing test and see if both ears are hearing at the same level, or if you're starting to fall off your threshold where you should be for your age, and that would be a sign that you might
Yeah.
want to consider a hearing aid.
And so many resources out there. We have Lawanda Thomas on with us from Atlanta Metro. Thank you for being on with us. She says, Dr. Fletcher, can having a stuffy nose and ears have an effect on headaches? Great question. Dr. Fletcher, help us out.
Yeah, so not directly. You can have sinus headaches, which are usually a pressure type headache, usually centered over your forehead, around your eyes.
Okay.
And typically, a sinus headache can be very similar to migraines. A lot of people that think they're having migraines or have sinus headaches, and vice versa. So I see patients for both. Stuffy ears don't normally cause headache, but certainly a sinusitis can produce a pressure type headache, which is virtually indistinguishable in most cases from migraine. So that's why seeing a specialist, if you're having any type of headache, even if you think it's sinus, is important, because there's certain tests that can be done to differentiate between the two.
Yeah, so powerful. Thank you for that information and great question. We've got the questions rolling in. Keep them going before we sign off in a few minutes. Shauna out of Atlanta says she has a runny nose, wax, and ear drip, especially at night. And she said she's asking a question, sir. How can she find your product that you mentioned? Help us out.
Oh, yeah. So we started our own sinus rinse. I actually, I had, there's a product that's out there that was not created by an ear, nose, and throat, which is very popular, called Neomed. And I felt like it was time to have something made by one of the experts instead of, someone who doesn't necessarily deal with it. So I decided to strike out and do my own thing. But my product is available in my office. My office is in Stockbridge. You can come and get samples. I give out samples very liberally. I'm working on getting it on Amazon now, and it's in a few
Okay.
local compounding pharmacies. We're trying to get it distributed that way. But we'll start giving out some samples on our website soon as well. But right now, if you just want to come by the office and get one, we have tons of them there, and you can grab one and give it a try.
Awesome. Are you in stores, retail stores?
Not right now, but that's coming. God willing, we're gonna start getting some distribution real soon. We just started, kind of putting it together with some of the local pharmacies, because there's pharmacies that give out samples of sinus rinses for medications that they compound, where
Okay.
sinus rinse, and usually those are free samples. So we decided to put our products along with that, and see if we can get it out there in the market. So.
Okay, great information. But Nasha out of Atlanta Metro has a question. She says, Doctor, what are your thoughts on having children and adults take meds all year round versus seasonal? Are there any long-term harm or effects? That's a great question, because I know I have people very, very close to me that take antihistamines year round under the direction of their physicians. So in your opinion, is that something that's needed for some people? And to Banasha's point, is there any harm done long-term?
That's a great question. I think it depends on the age group. There are certain ages that are more susceptible to complications of antihistamines, one of them being urinary retention in the older population. So in the older population, there used to be only a few different types of antihistamines, and a lot of people had trouble with the side effects. So I'm not a big fan of medication year round for any situation, but in some people, their allergies are severe enough where it kind of warrants that. The other alternative to the medication is allergy shots. A lot of people are really averse to needles, so they don't want to do the
Yes.
shots. The shots would be the next step if the allergy medicine was not effective or if it just was undesirable to stay on the medicine. So really the most important thing is if it's something you can avoid, like if it's a particular, if you're allergic to pets, for instance, pet hair, cat hair, you can get rid of your pet or you can stay away from pets, and that may just keep you from having to take the medication. If it's something that you're around all the time, like dust, you can try a filter for your home, which will filter out the air, but even then, some people just have really bad symptoms. So I would rather people take medication than suffer all year round.
Yes.
But the most important thing is if it's something you can avoid, then that would be a way to not have to take medication.
Yeah, man, great information. Thank you. Great question. Kenya says, will this be available to watch on YouTube? Yes, it is streaming live now on YouTube, and you can go back at any time on YouTube or Facebook to watch this. Okay, so we appreciate you watching and stay connected. Shana out of Atlanta says, oh, wow, I suffered from quarterly sinus infections when I worked in a corporate setting. I guess that goes back into when we mentioned, you were saying the HVAC. We were talking about some of those bacterial infections. But I guess if it's, I'm just going to say this mildew or mold buildup, sir, right, in some of the HVAC system that could possibly trigger worsening of your infections. Am I right or wrong? I'm taking a leap
That's
of my
correct.
previous knowledge here.
Yeah, that's correct. So building related hazards would be stuff like dust, mold, pet dander in some cases. There are certain, you know, molds that circulate in the air in the form of spores, which can get into the air. There's cockroaches, like some buildings have, you know, pests, which can, you know, there's people who are allergic to cockroaches as
Oh,
well.
wow.
So you just have to kind of get tested and then, you know, kind of go back to your place of employment and have them, they can be, you know, they can test their environment for these different things so you can see if you're at risk. But a lot of people have very specific building related allergies. And a lot of times it goes years before they get it. They'll figure out, oh, I've got this cough, or I keep having these sinus infections, or I keep, you know, sneezing all the time. I don't know what's going on. And so, you know, I've had a lot of people discover that their work environment was a problem. So it's
And I will say firsthand, doctor, I just want to share that I've had firsthand ENTs also share when you live in certain cities. You mentioned Atlanta, Metro, or Georgia, but perhaps Charleston or other ones that are close by the sea, that sometimes there are certain mold or things that do build up that some people will suffer from more commonly. And I've had that been told to me by ENT specialists.
Yeah. Very common.
Yeah. What great information. Shana says, thank you for sharing great information. And my own mother is speaking about getting my father samples of your nasal spray. We're gonna laugh and give two thumbs up at that one.
Awesome. Yeah, I would love to. I want to get it out there. I want people to give it a try. I made a specific design that's different than, you won't find this design on anywhere else in the market. And so I think it's a lot more gentle. Some people don't like the way it feels when they rinse their nose out. This is designed to be a lot more comfortable and to let just a small amount of water into the nose, so it's tolerable. Because we want it to be something that you're not excited to do, but that it's not uncomfortable to do. And so that's the purpose of the way we designed it. So.
Yeah. We're putting all spotlight on your health, talking about sinuses and allergies as we wrap up in the next minute or two. We did want to get a last question in, one of our final questions in from Cassandra out of Atlanta. She says, thoughts on dehumidifiers and air purifiers for office spaces. I love that. I'm going to say office spaces and also bedrooms at home, because I've heard mixed reviews on it. Help us out, Dr. Fletcher.
Yeah, great idea. Especially if you've been tested and you've been found to have any type of dust allergy or dust mites. Those things actually exist in your sheets and your pillows and your covers. If you go Google a picture of a dust mite, it'll creep you out pretty bad. So. But the filters are important because they actually filter the air for you. So, you know, you can sit one in your bedroom, and if there's a particular dust that you're susceptible to, you can also get hypoallergenic pillows and and sheets so that they actually shield you against the accumulation of those dust or dust mites. And those are all things that work together in the home. And then obviously, you know, just keeping the dust level down by sweeping and cleaning. Carpets, keeping the carpets clean, keeping the hardwood floors free of dust. Those are all important things.
Great question. I will say this. I've heard this before, and tell me if this is just an urban myth. They said when it comes to dehumidifiers and air purifiers, it is important though to make sure they're cleaned properly, or you could be creating another monster within itself. Is that true?
That's correct. As well
Yeah.
as if you use a CPAP machine, that's another one, which
Yeah.
the CPAPs have a lot of moisture because they're designed to provide some humidity, and so they can build up certain mold and germs and things like that. So if you have a CPAP, you want to clean that regularly because that's going right over your airway.
Yes.
And yeah, same thing with the filters and your fans too. Your fans tend to accumulate a lot of dust, so when they're circulating, they tend to spread it throughout the
That's a
house.
good point. Yeah, that's a very key point. We're speaking with an ear, nose, and throat specialist. He is one of the top leading head and neck surgeons out of Atlanta Metro. It's Dr. Aaron Fletcher. Michelle out of Columbia, South Carolina, the Metro. She has a question. She says, I have year-round allergies, doctor, and I suffer from sinus issues. I had surgery, which deviated septum. My allergy seems to be getting worse the older I get. Any suggestions? Zyrtec sinus rinse and nasal sprays I've already tried. Help us out.
Okay, so it is true, like I said, if your allergies can change with age, and so sometimes it's appropriate if you haven't been tested in a few years to get retested to see if there's anything new that's been introduced to your allergy panel that you may be reacting to. And then the next step, if you've tried, I would say the maximum medical therapy is a good antihistamine, a good nasal spray, and a good regimen of sinus rinses. If that's not working, then you may want to look into the allergy, what we call immunotherapy or allergy shots, where you get a small amount of what you're allergic to introduced into your system so you can build up a tolerance. And usually that's pretty much as good as we get. Other than that, you'd have to be living in a bubble, I guess. If you haven't done the allergy shots, that may be something to think about. There's a way that they can administer the immunotherapy under the tongue as well, in the form of drops, which is a lot more comfortable for people who don't like needles, but it is not always covered by insurance.
Okay, thank you so much. What great information. And Jada out of Columbia said she looks forward to trying the sinus rinse product. Thank you everyone for watching us. This was such a great and informative show. Doctor, before you leave us, I have to ask this very important question. We talked about the three big ones that are raving through the South: RSV, that's the influenza, and it's also COVID. What would be some quick tips to help us fight that off, as many of us want to stay as healthy as possible?
Yeah, so frequent hand washing, between contacts with people. I think a good sinus rinse obviously will help to keep the airways clean. That's where a lot of these germs are introduced into the body, is through the nose or the throat, the mouth. Like I said, respiratory droplets. So if you're keeping your nasal passages as clean as possible, that's an important thing. Your nose and your body have natural ways to fight infections when they enter the body. One of them is through your mucus. So if your mucus is healthy and it's flowing as it should and you're properly hydrated, that's important. So, definitely staying hydrated, definitely keeping your hands clean and keeping your nose clean also.
Awesome. Such basic things that they have taught us, especially the hands cleaning, but make sure we're aware of that over and over again. Thank you, Dr. Fletcher. Before we head out of here, how can our viewers connect with you or find out more information about your practice and your healthy tips? And I happen to know you have a very interesting YouTube character out there as well.
Yeah. So I kind of split my practice into two. I've got the regular sort of, ear, nose, and throat and facial cosmetic surgery that I do, which you can find me at aaronfletchermd.com. That's the website. I'm also on Instagram at aaronfletchermd. And then my brother and I, who's a nurse here in Atlanta, an LPN, who we both have musical passion and aspirations. And so we created this character called Dr. Knows Better, which is sort of a cartoon animated way to teach the best practices for ear, nose, and throat related care. And so that's Dr.knowsbetter on Instagram. And we also have a website called iknowsbetter.com, where we post a lot of our information. Our YouTube channel is also Dr. Knows Better. So we have videos that we created to teach people about how to take care of their nose and sinuses and various ENT related issues. So look out for that. We got a lot of different content coming, and we're very proud of what we do. My brother and I, we're really passionate about teaching healthcare and teaching people how to take care of themselves. So we look forward to sharing our content with you.